Now we're going to perform a quick cervical screen that will help determine whether or not the athlete needs to be referred for more specific physical therapy based on cervical symptoms. So what I'm going to have you do is I'm going to have you go through certain ranges of motion and then also check some strength and see if you have any tenderness around your neck that may warrant further evaluation. So the first thing you're going to do is touch your chin to your chest. And then what you want to do is ask the athlete if they have any pain and location of that pain. Do you have any pain?
No.
Good. Come back straight, look straight ahead. Oftentimes what the athlete will complain about also is that they will have an increase in their headache symptoms when they go through certain ranges of motion. So you want to note which motions provoke these symptoms. So now you're going to touch your head all the way back. Does that bother you at all?
No.
Do you have any pain or tightness?
No.
Good. All right, now you're going to rotate your head to your right, trying to look over your right shoulder. Does that feel okay?
Mm-hmm.
And then go to the left, looking over your left shoulder. Good. How does that feel?
Fine.
Go ahead and look straight ahead again. If they do have issues with rotating their head to the right or the left, they may also have these same symptoms when they are doing the VOMS testing. Now you're going to tilt your head to the right, trying to touch your right ear to your right shoulder. How does that feel?
Fine.
Good. And then left ear to the left shoulder. Good. And now straight ahead. So again, you want to check and see with any of these motions, does that increase their symptoms or do they have pain or tightness in their neck? And you want to note where that is. So now what we're going to do is we're going to talk about the areas where you would palpate to see if there's any increased pain. So for the palpation portion of the examination, you're going to want to start at the central spine as processes and just palpate along each one of them and see if any of those provoke her pain. Then you're going to come both on the right side of the paraspinal muscles and then the left paraspinal muscles. And you're just seeing if any of these are tender or any of them increase her headache pain. Then you're going to come up into the suboccipital area, palpate both right, central, and left. And then you can come down into the upper traps on both sides and see if any of those cause her increased headache or any dizziness. And then you're going to come along to the sternocleidomastoids on both sides. You also want to ask if there was any contact that hit her directly in the head, and you would want to palpate those regions too to see if there's any tenderness when you touch those areas.